Dr. McCarthy here, and we have a pretty loaded question today. What is chiropractic and how does it work? Well, chiropractic is pretty encompassing. If someone were to ask me, what is chiropractic, like what do you specialize in? I would say it's three areas that a chiropractor specializes in, and it's pretty big areas. It's the muscular system, it's the skeletal system, and it's the nervous system. And all three of those systems, I feel like, work like the chicken or the egg. They are all related to each other, and you can't just tackle one area without affecting another area. And it's typically when people come in with problems in our office, it's all three areas that are causing these issues. Maybe the joint is misaligned and it's putting pressure on the nerve, but guess what? That joint has muscle that's attached to it, so that muscle is also getting strained. So there's a soft tissue component to a lot of the problems that are coming in, as well as people can say, oh, I have tension in my neck, and that tension's causing a lot of tension and cramping in my neck. Well, guess what? If that tension puts too much pressure on that joint, it's eventually going to cause nerve pressure, and you're going to get radiculopathy coming with just simple muscular tension. And another one would be nerve pains. So I'm getting numbness and tingling into my fingertips, these bottom three. Well, why is that? Is it the joint that's misaligned and putting pressure on the nerves up here? Or is it the muscle system in here that's all tight from maybe putting your hand on the center console while driving too much, and it's just putting too much pressure in here, or it's from you doing too much gardening and pulling and raking and moving around, and now you got this whole arm swole up and tense, and now that's putting pressure on that nerve. So it's not just nerve pressure there. There's also three components typically bothering the problem. So how does chiropractic work? It's tackling those three areas. It's tackling how do we reduce nerve inflammation, how do we restore joint mobility, and how do we restore soft tissue function where it's no longer tight, tender, it's moving it's got 100% strength, we got normal flexibility in there. So what is chiropractic? Again, it's a loaded question. It's a physician that is tackling three major areas. And I know a lot of chiropractors or a lot of people from the outside looking in will say chiropractors are joint movers, bone crackers, stuff like that. And that's just very simplistic terms. If you really look into it, it's more neuromuscular system than anything.